Hey everyone, welcome to week 6. The purpose of this video is to go over the DAP Note assignment. So I will be using the information collected in the role play with Alex and the information that I used to do the mental status exam for this DAP Note. So the staff completing form, you're going to put your name, the date you complete the DAP Note, as well as the patient or case study name here. In the data section, so this is where the information that we pull from the thought content piece of the MSc is going to go. In practice, we would also put any interventions or strategies that we use with a patient, as well as any psychoeducational materials or skills that we practice with the patient. All of that would go here. So what I decided to put for Alex, we also mentioned this in the Zoom meeting last week. We do want to put as many quotes as we possibly can. We don't have a lot here from this role play. However, in practice, you do want to capture as much relevant statements by the patient as possible. So here, coming from, again, the MSc role play, it says patient reports, I really like it, referring to the program, and quote, I feel better. She reports that she has been practicing breathing exercises and meditations learned in groups. She also reports that she has not used alcohol since intake and has cut down marijuana use. Patient reports some improvements at home and attributes this to staying busy. Patient also reports increased motivation and attributes this to reduced marijuana use. Okay, so the assessment piece, this is our professional opinion, if you will, of the patient. So here we use some type of terminology that says that we are going to elicit our opinion, our professional opinion. So we would use some type of statement such as patient appears, or it appears that patient. So patient appears motivated to develop skills to manage anxiety symptoms evidenced by attending groups and practicing skills learned. Patient would benefit from attending groups such as grounding and combining compassion and anxiety. So one other thing that we also have to remember here in this piece is that we want to make sure that we're giving updates about the treatment plan. So we want to make sure that we're discussing those goals in the session and noting any progress that's been made. So something that was on Alex's treatment plan was learning how to manage anxiety symptoms. And so this statement here about practicing breathing exercises and meditations is something that was specifically on her treatment plan. Okay. Also, in the plan section, so the patient agrees to continue practicing skills learned in groups, taking medications as prescribed, and meet with social worker. So I just want to say that much of this information is going to be directly taken from the case study, the MSc info piece of the case study. However, I do want you to do more than just copy and paste what you have in the MSc. I do want you to elaborate on this. This might just be adding in information about a statement that was made. We're just going to expand on what's there so we can see so I can assess whether folks are using appropriate clinical language in the writing. Okay. So in the assessment piece, that is not something that has been written for you in the mental status exam. So this is something that you will have to do on your own. So this is, again, professional opinion based on what patient has reported. And so we can assess things like motivation. Do they seem like they're here in treatment, doing the best they can to develop the skills? Or do they seem unmotivated or distracted by something, let's say relationship issues or something at work? What we feel they would benefit from moving forward in the program. And we also want to include this is a really important thing here when we're making these objective statements or subjective statements, excuse me, is that we want to use this term evidenced by. So when we make a professional opinion about a patient, we want to include any evidence that would support that claim. Okay, so we know that the patient seems motivated to develop skills because she's attending groups and practicing the skills learned. Okay, we might not know for sure that they're doing this, but this is something that they're reporting, which is really, we need to take at face value. And then back to this planning section. So what does the patient agree to do moving forward? So continue practicing skills learned in groups, taking meds as prescribed, and to meet with a social worker. If we were to assign homework to a patient, this is where we would say patient agrees to complete the assignment given or the homework given. Also, in this case, Alex needs aftercare treatment. And so something after she met with the social worker, something in the plan could be patient agrees to contact resources given for outpatient therapy. Patient agrees to call by, and you could set a date in a couple days or something like that. Okay. So again, pretty straightforward. The piece that I really want you to overemphasize here is the assessment part. So this is where we're really going to shine through if we're understanding this clinical jargon and see if we can make appropriate assessments to what we're seeing the patient, how the patient's presenting. So please feel free to reach out to me if you have any questions. And congratulations on making it to week 6, and we will see you next week.